Hello to all of my friends out there in the blogosphere. I'm Jeff Harris. I have a little blog that I'm starting here called Untangled Health. And the whole idea is that collectively, us, that's you and me, can understand the existing complexity of our healthcare system and maybe just sort of untangle it and try to explain it to others that have such a hard time navigating it. It would be a great service. It's one that I don't even think we need to pay for. It's probably one that we can do for ourselves if we just take some things into consideration. What I'd like for you to know is that I grew up in high-tech world. High-tech of the 1960s, when my dad built rocket boosters in northern Alabama that were used to carry men to the moon. And I used to listen to the engines roar as they were being tested 2 or 3 miles from our house. And in July of 1969, we actually launched one of these things. 42 years ago, we performed a miracle. We sent people to the moon, we brought them back safe. And you just think about the coordination of effort required to get there, and the desire, and the strength. So what I'm perplexed by is this. Regardless of what one has to say or where they're coming from in terms of political background, we have huge disparities in our country in terms of healthcare outcomes based on how wealthy we are. And you'll notice that from decade to decade, the poorer people die earlier. And if I was to break the outcomes out for you into more detail, you would find that they get sick earlier. Why is it? I don't understand it. 42 years ago, we sent people to the moon. I don't understand it. We're not even in the top 5 or 6 nations in the world in terms of affordable care that delivers quality life for all of us. Here's the difference in the outcomes. 2 weeks ago, I stood next to a man in church. He said his whole family was having their feet amputated when they got about to be 50 years of age because they were all diabetics. This is the kind of foot that he had. This is the kind of foot that I have after 40 years with diabetes. Significant difference, don't you think? So I propose to you that America has the best healthcare system in the world. For some of us. If you're lucky enough to belong to a plan that measures your care and provides ways to refer you around to specialists, you get a little referral and you go over and you get the high-tech stuff and the interventions and you get fixed. If you're less fortunate, you may not get that, as shown earlier. So I'm going to suggest something to you. Based on my 35 years of experience in healthcare, working as provider, hospital administrator, program manager, clinical informatics person that designed computer systems, and health policy person, I judge that the variables are so numerous and so complex that we're operating at levels of abstraction that are far greater than anybody could ever understand, and we don't even know that we're confused. I, for myself, am tired of the political rhetoric. Both sides of the aisle disgust me, and I'm walking away from them. Conservative or liberal, it doesn't matter to me. I'm tired of listening to the talking heads and the pundits and the individuals on radio and television who do nothing but devise us. They take us apart with anger and rage and plot us against each other. All I'm interested in here is how we're going to approach this as individuals, as a collective, and define ourselves a healthcare system based on our constitutional right to well-being. I I have many experiences in my career of corruption across the market sector. Providers, patients, insurance companies. Later, if you are willing to play with me and dance and give me some feedback and you ask for it, I'll show you some of these data. We all are in a system where we're going to get sick someday, unless we die of blunt trauma on the highway. You're always going to ask yourself, is my diagnosis correct? What are the consequences of my diagnosis? What are my treatment alternatives? Does one treatment work better than the other? Is the best treatment available? Can I even afford it based on who's paying for it and what my copays and deductibles are? Or do I even have insurance? What steps do I take to assure success? Actually, I judge the fact that most of us don't take enough steps towards success, and we need to do more of that. So here's where I'm coming from. I've worked among providers, medical product manufacturers, insurance companies, and policy gurus. Really brilliant people. I judge that we need to form a collective and take the time to understand our own bodies and our healthcare system, and we need to do it because it's evolving quickly. It's a new system. It's a hot topic of debate. It's very complex with multiple layers. If you don't participate, you don't want to play, then what's going to happen is more than likely you're not going to get what you really need for you and your family. So if you're willing to do this dance with me, sign on. Become my friend. And I'll become yours. I'm not paid by anybody for this. There's lots of people being paid what I would say billions of dollars in the industry today to influence your opinion. It's not my game here. I just want you and me to be healthy and happy. So come on along. Come along on the ride with me. Let's have some fun. Okay.